Ladies and gentlemen, please stand by. We're about to begin. Good day and welcome to the NCD Alliance webinar. Today's conference is being recorded. At this time, I'd like to turn the conference over to the Chief Executive Officer of the NCD Alliance, Ms. Katie Dane. Please go ahead.
Thanks very much, and good morning or good afternoon, everybody, and welcome to this NCD Alliance webinar on Tuesday, the 31st of July, 2018. Next slide, please. So in terms of what we're going to be focusing on today's webinar, we have a lot of updates for you because there's obviously a huge amount of activity going on, particularly in New York with the high-level meeting on NCDs. But in terms of what we'll focus on for the next hour and a half, firstly we'll give you a very brief update on a few NCDA-related matters, including a couple of new members of staff that have joined the team that we wanted to introduce, as well as sharing with you news of our new membership offering and structure. Secondly, Priya Kanaisen will be updating you on the UN high-level meeting on NCDs, which is obviously full steam ahead in New York at the moment with the negotiations going on. Thirdly, we'll be giving you news of the recent UN high-level political forum that took place in New York just a couple of weeks ago, which is obviously the annual review mechanism for the Sustainable Development Goals. Fourthly, we'll be giving you an update of where we're headed with the WHO regional committee meetings that will be starting just in a month or so's time and throughout September, October, and November. And then finally, we'll be updating you on our Enough campaign, which is obviously all about the high-level meeting, as well as the Global Week for Action on NCDs that we're excited to be sharing more news with you about. Next slide, please. So in terms of our speakers today, we have an all-star team of NCD Alliance staff. Priya Kanaisen will be providing you the update on the UN side of things. Jessica Beagley will be giving you the updates on the WHO regional committee meetings as well as the high-level political forum. Josie Galea-Barron will be sharing updates on the interactive hearing that happened just last month. And Lucy Westerman will be sharing with you updates on the Enough campaign. So with no further ado, let's get straight into the agenda because we have a lot to cover today. Next slide, please. Next slide. So firstly, just wanted to briefly introduce you to two new members of the NCD Alliance team. Really pleased to share that we have Nina Renshaw just joined us as the NCD Alliance Policy and Advocacy Director, who will be based in Geneva. Nina comes from the European Public Health Alliance, where she was the Secretary General and has 12 years of policy and advocacy experience straddling different areas of health, environment, and we're really pleased that Nina will be joining us in this position. We've included the email addresses of our new team members there on the slide as well. Secondly, second team member to join that we wanted to share with you is Dora Maradiaja, who is our NCD Policy and Advocacy Officer based in New York. And this is actually a joint position between the NCD Alliance and Vital Strategies, who are one of our supporters. And so Dora will be working very closely with Priya, who you all know very well, on our New York, US-based policy and advocacy work. Really pleased to have these to join the NCD Alliance team to really strengthen our policy and advocacy work going forward. Obviously, it's a really important year for NCD policy. Next slide, please. The other brief update we wanted to give you at the beginning was just to mention, and you've probably all seen this, that we have launched our new membership structure. This is, as a bit of background, related to the transition of NCD Alliance from being an informal organization for the last 8 years to becoming a registered NGO in Switzerland that happened last year. As part of that transition, we have a new consolidated membership structure which we launched just a couple of weeks ago, and so just to provide you with a bit of information here on the webinar. Next slide, please. Firstly, in terms of how to apply to become a member, we have a fairly simple and straightforward application form online, and the details of that are here, along with the email address that you can contact for further information. Next slide, please. But most importantly, kind of reasons to become an NCD Alliance member. First and foremost, it provides organizations, civil society organizations, academic organizations, professional societies to really join the global NCD movement and represent your priorities internationally. So by becoming a member, you'll be at the heart of the global NCD world and community, contributing to global advocacy efforts, and obviously engaging with us through our global NCD events and discussions. It will also be an opportunity for you within your own part of the NCD community to connect and with experts regionally and globally, and to really leverage opportunities for action. Obviously, as an alliance that spans so many different areas of this very broad community, it's really an opportunity to understand what works, what doesn't work from different parts of the NCD movement, and to really forge strategic partnerships and connecting with other parts of the NCD world. And thirdly, it really is an opportunity to increase your organizational capacity and take your advocacy work really to the next level. So through membership, you'll be able to participate in online and face-to-face training opportunities and access kind of some of our key NCD Alliance platforms of best practice, as well as also, most importantly, sharing your own experiences and lessons learned. And so these are kind of some of the reasons why you could become an NCD Alliance member now through this new structure that we have in place. Next slide, please. In terms of who can become an NCD Alliance member, we've opened up our membership to civil society organizations, national and regional NCD alliances and networks, of which we know there are over 55 alliances today around the world, national associations and societies, patient organizations, and professional societies. And we obviously kind of consider all of these organizations as part of the civil society movement for NCDs. Just to flag that in terms of who can't become a member, it's the private sector, it's businesses, it's foundations and philanthropy, and it's governments. Next slide, please. And then in terms of what are the options for becoming a member, there are two main membership categories. Full membership, which is available to organizations, networks, and entities that are substantially engaged in NCD policy and advocacy and practice, and wish to have a more of an active role in NCDA's governance and strategy. And then secondly, associate membership, which is available to organizations, networks, and entities that support NCDA's objectives and activities, but have lesser a role in our governance and strategy. And you can see here on the slide we've got a set of kind of membership fees that would be applicable based upon the country that you are based in. So we've got a tiered pricing membership fee based upon the income country that you're set in. So those are the two main membership categories that we have opened up, and we're really excited about strengthening relationships with many of the organizations that we've been working with for many years, particularly those who are an existing part of our network that we've grown over the last kind of almost 10 years now. Next slide, please. In terms of the membership benefits, just to kind of flag the main difference between our full membership and associate membership is really the role that you can play in our governance. In the new structure, what we'll be having is a General Assembly every 2 years that will be electing the President and the board members for that term. Full members are invited to General Assemblies and have a vote in those General Assembly meetings. Associate members are invited as observers, but they won't have an actual vote and an opportunity to put names forward for the board. So essentially the main difference between full and associate is really from a governance perspective, how much of a say and how much of a voice you will have in our governance structure and in our governance discussions and strategic discussions as well. And in addition to obviously those two categories of full and associate membership, we've also got the continued opportunity of becoming a supporter, which many of you already know about, and that's a closer circle of kind of partners that we work with, which meet on a kind of quarterly basis in the fight against NCDs. So that continues to be open as an opportunity. Next slide, please. So that in a nutshell is kind of the opportunities that we wanted to share with you in terms of membership. We've included in this slide the website link to find out more information, and you'll find on that website, that page, the membership brochure that we have, as well as a set of membership principles that we've established, as well as how to actually apply. And would really strongly encourage those that have been actively involved in the NCD Alliance for many years to really consider applying, because it's going to be a way that you can really elevate your voice and strengthen your relationship with us as the broader alliance. Next slide, please. That's the very brief update just to start the webinar. So an update on the team as well as an update on membership. Now let's move straight into the first presentation, which is a presentation on where we're up to with the third UN high-level meeting. So next slide, please. I'll hand over to Priya Kanaisan to give the update on the high-level meeting.
Great, thanks very much, Katie, and hello all. As Katie mentioned, there's quite a lot happening in terms of preparations for the high-level meeting or HLM that will take place in September, and so I wanted to provide everyone with an overview of what's been going on here in New York. I'll start off with the interactive stakeholder hearing that took place on the 5th of July in New York. There were over 300 participants, and there was a much stronger presence of civil society than in 2011 and 2014. There was also very good member state attendance, and I saw at least 14 to 20 around around 20 member states, and there were many more in the room coming in and out throughout the day, which was really good. As you can see, some of those member states who are listed are indeed key players in the negotiations and in the NCD process here. There was very much a strong sense of the voices of civil society and also people living with and affected by NCDs, making statements on the floor as part of the panel speakers and also during the side events. A couple of the things that came out was the integration of mental health and also addressing air pollution as a risk factor as very central components of the NCD response that needed to be taken into consideration in the high-level meeting outcome document, as well as a refocus and strengthened focus on political leadership and accountability. One of the things that I think was very clear to everyone who was attending in the room was this divide between private sector and civil society, with private sector panelists and those private sector participant statements really questioning the use of sugar-sweetened beverage taxation or taxation more broadly and other fiscal policies and measures and calling for less regulation, while civil society was very much calling for full implementation of the WHO best buys and other recommended interventions, and again, a strong focus on accountability. So this interactive stakeholder hearing, again, it was not only civil society, but was for all stakeholders as defined by the UN, so that included academia, philanthropic foundations, private sector, and NGOs. So there's a broad range of representatives in the room. All of the statements that were made are available on the WHO website if people were able to submit those via email. And NCDA has pulled together a summary that's also available on our website, and we are awaiting the President of the General Assembly's official summary that will be online soon. And again, the links that you will find in the webinar, they will be active when the slides are posted on our website. So the links will not work now. So this stakeholder hearing was very much part of the preparatory process for the high-level meeting. So the member states were very much listening to what stakeholders had to say, what civil society and again other stakeholders had to say as some of their priorities for the high-level meeting. The timing of the stakeholder hearing was very good, actually, given that it happened at the beginning of negotiations on the outcome document. There had in fact only been 2 rounds of negotiations, and we'll talk a little bit more about the negotiations timeline in just a moment. So the fact that this happened early on was really beneficial in the sense that member states could hear what stakeholders had to say in advance of the document becoming more finalized. And I will just briefly turn over to Josie to give an update on national and regional advocates and the high-level meeting process. Josie, over to you.
Thank you, Priya. we just wanted to take a very, very brief moment to present the kind of the role and the contribution that national and regional advocates played at the global hearing. 17 national and regional alliances attended the hearing, and this really speaks to those linkages between the global and national level advocacy efforts and the importance of making sure that country advocates are and people living with NCDs are an integral part of the high-level meeting campaign and all global processes. Another very positive thing was the Put People First advocacy message was really emphasized throughout, including at a side event in collaboration with WHO and supported by the WHO Civil Society Working Group, which focused on the role of civil society and ensuring a people-centered approach. And we heard from national-level advocates and people living with NCDs on their work and experience and priorities at that event. In another component of this, we had an Advocacy Institute Accelerator Program fly-in, which is part of our capacity development initiative of the Advocacy Institute. It involved 5 countries, Mexico, Brazil, Colombia, South Africa, and India, who took part in a 2-day workshop represented by one leader of an alliance and a person living with NCDs from that country. They took that time to discuss the UN processes as they relate to NCDs. Most of them had the opportunity to meet formally with their national missions to the UN to discuss their campaign priorities from their specific national civil society perspective, and they have the time to share experience and best practices between the different countries. And this is all part of the program in that it tries to support these established national alliances to bolster national level advocacy, but also as much as possible linking to global processes and the UN. I'll hand it back to you, Priya.
Great, thanks very much, Josie. So we'll move straight into the negotiations process, and this is very much an overview of the timeline of negotiations to give you a sense of how things have progressed over the past months and almost 2 months now. So the negotiations really kicked off at the beginning of June, on the 7th of June, when the co-facilitators, again, these are the ambassadors of Uruguay and Italy based in New York, who really guide member states through the process of negotiating an outcome document for the high-level meeting. They presented what's called a zero draft elements paper to all of the member states here in New York, outlining what they see as crucial for inclusion in this outcome document, which will be a political declaration. There was a break for the remainder of June until the 29th of June, and that was really to allow the negotiations on the tuberculosis high-level meeting outcome document to take place. Again, that meeting is occurring on the 26th of September, the day before the high-level meeting on NCDs. So during this time between the 7th of June and the 29th of June, member states took this period to share the zero draft elements paper with their capitals and their Ministry of Foreign Affairs and Ministries of Health, and provided and really prepared their feedback on that zero draft elements paper. They then met on the 29th of June for the first round of what's called informal negotiations, and these negotiations are member state only, where member states provide quite substantial feedback on the language and substance of the draft paper. They then met on the 3rd of July, again that was just before the interactive hearing, for a second round of informal negotiations. After the 3rd of July, the co-facilitators shared what's called a compilation text, where they include all of the feedback and inputs and language suggestions, whether that's additions or deletions from various member states, into one document. And the negotiations then took place on the 18th and the 20th of July on this compilation text. Following that, then the co-facilitators cleaned up the compilation text and produced a second draft, a clean draft, that no longer included every single input, and that was a basis for negotiations on the 24th and 25th July. And then they, based off of the input and feedback from member states on those 2 rounds of negotiations, they then produced another clean draft ahead of the 27th July meeting. The 27th of July, last Friday, was quite an important round of negotiations, as actually what happened was that member states agreed ad ref, or ad referendum, on all but one of the paragraphs in this draft text. That means that they have agreed provisionally to the text and the language, meaning that assuming no one raises any substantial issues, that the text that we saw in the 27th July version will be the final text in the political declaration. The outstanding paragraph is on TRIPS and sort of looking at access to medicines, and as outlined in the Doha Declaration and dealing with intellectual property and transfer of intellectual property. And so the next steps, because of this one outstanding paragraph, which is very much linked to what's happening in the process for tuberculosis, again, as you can imagine, access to medicines, research and development, and drug pricing and such is very important for the TB as well as the NCD process. And member states are now negotiating language on TRIPS that is meant to be shared with the co-facilitators for inclusion in the draft. Once that happens, the co-facilitators will circulate a new draft for consideration, again, new as it will have that new language on TRIPS for one paragraph. And assuming that member states raise no objections, then this draft will be sent as the co-facilitator's final text to the President of the General Assembly for a process that's called silence procedure. Silence procedure is what happens at the end of all intergovernmental negotiations when a provisionally agreed or ad referendum agreed text is circulated for 24 hours to all member states. If at the end of 24 hours none of the member states break silence, that is expressed that they take issue with particular paragraphs or a paragraph in the text, then the text is considered agreed and goes forward for endorsement and adoption. However, as many of you might know, for the TB process, silence was broken early last week by South Africa, and this was because of the very weak language on TRIPS. And so South Africa, I think, backed by a few other countries who also wanted to see stronger language on TRIPS, broke silence on 2 of the paragraphs that were related to this issue. And that's why the language there and the language in the NCD document are very much linked. It's likely that whatever is agreed on this particular issue will be the same in both the NCD and the TB document, or very similar. So in terms of timing, we are still waiting to receive the updated text on TRIPS language from the co-facilitators in a new draft. Member states in New York have not received any further information from the co-facilitators, so we're very much in a holding pattern right now. But it's anticipated that this will be wrapped up by the end of this week. So in terms of the current text, and again, this is the text that was discussed on the 27th, last Friday, just wanted to give a brief overview on some of the positives and some of the weaknesses that we've seen and that we've heard from member states who are in the room. I think one of the really good things to see in the draft text is that recognition of the role of heads of state and government to provide leadership for the NCD response, including through policy coherence and coordination and adopting a health in all policies approach. Again, that's something that we want to see, especially in the lead up to this high-level meeting on universal coverage that will take place next year. There is general language on scaling up implementation of commitments made in the 2011 and 2014 high-level meeting on NCDs, as well as the NCD-related targets in the 2030 agenda. I think something that we as the NCD community will be very happy to see is the inclusion of social, economic, and environmental determinants, as well as the commercial and market factors as having an impact on the and on the NCD response, as well as looking at addressing NCDs within humanitarian settings and natural disasters. There's also language on air pollution, both indoor and outdoor, as well as water and soil pollution, exposure to chemicals, and climate change as having a very big impact on NCD risks. As well as the recognition of the need for a gender-responsive approach to NCDs, and that's recognizing both the need for gender-sensitive and for women and men when addressing NCDs. There's very strong integration of mental health and neurological conditions throughout the text, as well as palliative care and looking at screening, diagnosis, and treatment and care. There are separate paragraphs on addressing NCDs in children and older persons, so looking at the specific needs of both these vulnerable populations. Given the fact that there is a high-level meeting on tuberculosis, it's good to see that there's a paragraph and language on integration of NCDs and communicable diseases, specifically calling out those such as HIV/AIDS and TB again, looking at the meaningful engagement of civil society and people living with or affected by NCDs, which is good. We haven't seen that language before. There's also language on fulfilling human rights obligations, so looking at the right to achieving the highest attainable standard of physical and mental health and well-being. There is reference and footnote to all of the relevant WHO documents and agreed plans. So there's overall, I think, some very good, strong things in this document that we're happy to see. However, there are very much some weaknesses in the draft. There's no real analysis of the commitments in 2011 and 2014 on sort of what has not been achieved, which we know most of those commitments have not been reached. So there's no real recognition of that lack of progress there, and no measurable commitments on how to reinvigorate political leadership and actually drive forward the response. While there is recognition of fiscal measures for NCDs, there's no explicit mention of price or tax. More problematically as well, the phrase promote healthy lifestyles has been retained, as well as the phrase empower the individual, which again is problematic when we're talking about sort of blaming people who have NCDs. Again, there's no explicit mention of the WHO best buys, and that's something that we've shared before, having to do with some political maneuvering by member states. Despite that, there is mention of the WHO cost-effective recommended interventions. So the best buys are in there, but not explicitly mentioned. Another thing that was disappointing to see was the lack of mention of renal, eye, and oral diseases or other NCDs. That's something that we as NCDA were pushing very strongly, and we know that member states, particularly in the G77, were also pushing for inclusion of those diseases, other NCDs. The section on private sector is lifted directly from the 2011 outcome document, so there's nothing new. However, I should flag that as one of the positives. There is language in the document around engaging with the private sector as appropriate. So again, that caveat when engaging with the private sector, and then also managing conflicts of interest when engaging with the private sector. And so those two things are good to see, but again, there's nothing new in terms of working with the private sector. There are no new time-bound or measurable commitments, again, making it difficult to hold governments to account. And the next high-level meeting is called for in 2025, so a period of 7 years, which is quite a long ways away. So those are some of the weaknesses. Again, we haven't seen the final version of the document, and from what we understand, the language is now more or less finalized in everything except for the paragraph on TRIPS. So moving into the program structure for the high-level meeting, this is just to give a visual sense of what will be taking place on the 27th of September. As for those of you who have registered to attend, and I hope most of you have, as the deadline is today, and you'll have noticed that you were asked to register for either Conference Room 4 or the ECOSOC chamber. In Conference Room 4, there will be the opening and closing segments as well as the plenary, and in the ECOSOC chamber will be the two parallel multi-stakeholder panels. And the opening segment, we've heard the speakers will include the incoming President of the General Assembly, who's the former Minister of Foreign Affairs of Ecuador. She's actually only the fourth female President of the General Assembly. And the Secretary General will speak, the WHO Director General will speak. It's likely that the President of either Finland, Sri Lanka, or Uruguay will speak, and that's being finalized now, as well as one eminent person, and we've heard that it's likely to be Princess Dina of Jordan. And at the end of the opening segment, the outcome document, the political declaration, will be adopted. So we move straight into the plenary and the concurrent panel. So it's important to note that for those of you who have registered, you are only able to attend the high-level meeting in the room that you have registered for, and you will not be able to move in between rooms. This week during the high-level meeting is quite high security, as you can imagine, with many heads of state and government, and so attendance is strictly for the room that you've registered for. During the plenary session, that's when member states and UN agencies will be making statements, and I'll talk a little bit more on the next slide about the head of state and government speaking slots that are available for the plenary, and then we round out the evening in that Conference Room 4 with the closing segment. In the multi-stakeholder panels, we understand speakers are still being finalized, and this is all being run exclusively by the President of the General Assembly's office. That lunch break between 1 and 3 p.m. is when quite a few side events will be taking place, and again, I will flag a few of the side events that we're currently aware of. Finally, the thing to note is that during the panel segments, so from 11 to 1 and then 3 to 5 in the ECOSOC chamber, that is the opportunity that observers, so civil society and other stakeholders who are attending the high-level meeting in the ECOSOC chamber will have an opportunity to speak from the floor. However, preference will be given to member state attendees. As you can imagine, this high-level meeting is for heads of state and government, so they have preference for speaking from the floor. The plenary segment is only for heads of state and government, again, so member states and UN agencies. So it's difficult to say if people will actually have a chance to speak, as it very much just depends on two things: the time available left in the panel segments and how many member states wish to speak. So looking at head of state and government attendance, the President of the General Assembly has allotted 85 speaking slots during those two plenary segments, so again from 11 to 1 and then 3 to 5, and he's divided out the speaking slots among the UN regional groups. You can view the UN regional groups at the link at the bottom for which member states are part of those groups, but the African group has 24 slots. Right now we've heard of 2 heads of state confirmed. Those are Egypt and Morocco. Asia Pacific region also has 24 slots. We've heard of 3 heads confirmed, as you can see there. Eastern Europe has 10 slots. We haven't heard any confirmed thus far. GRULAC is the Caribbean region as well as Latin America. There are 14 speaking slots and 8 heads confirmed. I think no surprise that that region has the most interest thus far from heads of state and government, given the real leadership that we've seen from the Latin American countries, South America, and CARICOM. So you can see the 8 member states heads who have indicated that they will be speaking, and then the Western Europe and other groups have 13 speaking slots, and 1 head of state and government is confirmed, and that's Finland. So this is very much a moving target on this piece, and we really encourage folks to use this as an advocacy opportunity to encourage their heads of state and government to A, attend the high-level meeting, and B, indicate that they would like to speak. And the process for that is that WHO reps, in-country reps are meant to really mobilize the presidents and prime ministers, and then indicate to the Ministry of Foreign Affairs that the head of state or government would like to speak. The country Ministry of Foreign Affairs contacts the permanent missions in New York, as it's the permanent missions in New York who are really driving this process and coordinating, if you will. And they then, all the missions who are part of these regional groups, indicate to the chair of the UN regional groups that their head of state or government would like to attend. The chair of the regional group will then let the president of the General Assembly know that a head from a particular region would like to speak in one of those allotted speaking slots. This process has to take place by the 15th of August, so there are still about 2.5 weeks, I believe, to really mobilize heads of state and government to indicate that they would like to speak at the high-level meeting. So I mentioned this briefly, but just to flag again that registration for the high-level meeting closes today. I won't spend too much time here, but even if you are not sure if you will have the funds to attend the high-level meeting, please do register in case the funding becomes available, because after the 31st of July, there is no mechanism for a participant to register. And again, this is available for NGOs who are in consultative status with ECOSOC, as well as those organizations and other stakeholders who completed the special accreditation process. And it's the same list of organizations who are able to register for the hearing. So again, registration closes today, the 31st of July. Please register if there's even a slight chance you might be able to attend. And looking at moving quickly into side events during that week, as everyone knows, there's not only 2 high-level meetings on health taking place. The week of the UN General Assembly is always in New York, a very, very busy week. So as always, we as NCDA are compiling a list of health-related events taking place during the week of UNGA. And our calendar of events right now includes mainly NCD-related events, but is starting to include other health events as this information comes in. So flagging that on Monday afternoon from 1:30 to 4:30, NCDA will be hosting a civil society advocacy briefing, and the Monday is really kicking off the whole week and sort of giving an overview of what we as NCD, civil society, and stakeholders can do going into this high-level week. And these side events continue throughout the week, so from Monday to Friday, and more information again will become available as the weeks go by, and this will be posted on our website by mid-August, and we will have an updated version available quite regularly. And so just to flag that if anyone has any information about side events that they are holding or that they're aware of, to please send the information to us, and we can then include it in our calendar. So I'll pause there, and Katie, turn it back to you. And just to say that I've noticed that some people have their hand raised. If you could please type your question in the chat box, we can then address it.
Thanks, Priya. Brilliant presentation as always, with a huge amount of information for everybody to be taking in on the process and where we are with the political declaration negotiations. Just a couple of other pieces of housekeeping before we go to the questions for this section. We will, as always, be making the PowerPoint available on our website after the webinar, and we'll also have a recording on the website available for those that weren't able to join or want to listen in again to certain parts of it. And as Priya said, please do type in your question to the chat facility box on the left-hand side of your screen. Okay, so we're getting some questions in for you, Priya. Just as a reminder for everyone, please do register for the high-level meeting if you haven't, and the deadline is today. And as Priya said, the fact that we have got 14 heads of government and heads of state registered for the high-level meeting is positive. It's more than we had for the high-level meeting in 2014 with a big fat 0. But we are only halfway there towards the goal that WHO has set themselves anyway, which is around 35, which was exactly the same number that we had in 2011. So I think it's all, all to play for in terms of getting more presidents and prime ministers there in New York for that week. Okay, so questions, Priya. We've got one from Matt about will there be available the second draft of the political declaration? Obviously the 0 draft was made publicly available. Will we be able to see the second draft of the outcome document?
Sure. So the drafts are actually currently internal confidential member state drafts. There's nothing publicly online. But once the draft goes into silence procedure, then it will indeed be posted online, and we will certainly share that with our network and on our website once it's available.
Thanks, Priya. There's been a question from Katie around, is the correct terminology the political declaration or is it the outcome document?
Sure, thanks, Katie. They're actually interchangeable. The outcome document is a political declaration, so you can refer to it as the outcome of the high-level meeting will be a political declaration, but they're very much interchangeable. The political declaration is in fact the sort of highest level version of an outcome document because it's something that heads of state and government endorse at the high-level meeting.
Thanks, Priya. And so the reason why, just in terms of the previous high-level meeting, so in 2011 it was a political declaration because heads of government, heads of state were there. 2014 we have an outcome document, and so the reason why that was because there was no heads of government and heads of state there, right? Is that correct?
Exactly.
Yeah. Great. Thank you. We've had a question around the actual structure of the 27th of September. So you went through the agenda for the day with the different plenaries and the multi-stakeholder panels. We've received a question of if other slots to speak in the multi-stakeholder panels are available. Will they become available to civil society, or is that all fully cooked before we get to the September meeting?
So if the plenary segment is for member states and UN agencies only, for the multi-stakeholder panels, as mentioned, the format will be that the panelists speak, and then it will be open to the floor. Preference will be given, again, to heads of state and government and UN agencies, and then it will be available for other stakeholders who are attending. There's no sort of predetermined list of who speaks from the floor, as it really depends on who is in the room. So again, for those of you who attended the hearing, you will know that the system for indicating that you'd like to speak at the UN is to press the button at your seat that flags the microphone button. So that will be the same system for the high-level meeting for those people who are in the room of the ECOSOC chamber, which is where the panel is taking place.
Thanks, Priya. Had a question from Mike. What do you think the impact of the Climate Week activities will be on the UNGA Week and the high-level meeting? So Climate Week's happening 24th to the 30th of September and is one of the kind of major summits in the international calendar around climate action. Do you think that will have an impact on level of participation at the high-level meeting itself, Priya?
Thanks, Mike. No, I don't think it will. Previous years of the UN General Assembly, there are almost always concurrent parallel activities taking place during that week of the UNGA. And as everyone knows, that UNGA week is quite hectic. I don't think we're going to see a diminished participation or engagement around the high-level meeting or around that week on NCDs. And to flag, for people who are interested, there is mention of air pollution looking at climate change in the NCD political declaration. So there are some synergies there with what's happening at the Climate Week.
Lovely, thanks. We've got two questions related to political declarations. We've got one question around, is there a time still to submit a statement about the zero draft, and would that still be indeed useful? The second question, which is actually related to the TB political declaration that has also been negotiated at the same time as the NCD one in New York. Obviously the TB high-level meeting is happening the day before the NCD high-level meeting. And Priya, the question from Deanna is do we have mention of NCDs in the TB political declaration, and I think vice versa, do we have TB mentioned in the NCD political declaration?
Yeah, thanks for both of those questions. So the first on looking still time to submit a statement about the zero draft. Quite frankly, the zero draft that's available online is very different from the political declaration version that was agreed ad ref on Friday. If the person who asked the question, I think Bistra here, I'm seeing the name, was interested in submitting a statement as part of the interactive stakeholder hearing to WHO, there's certainly, I believe, it's still open for submissions, and we can share the email address for that. The narrative now that that NCDA is taking, we put out a statement last Wednesday noting some of our concerns about the weaknesses in the document, and we will be continuing to do that over the next few weeks, is highlighting some of the strengths of the document, but then also the weaknesses and some of the missed opportunities. In terms of the mentions of NCDs in the TB political declaration, yes, there is very much a mention of NCDs looking at sort of the shared risk factors for people living with tuberculosis and NCDs, and also the need for an integrated approach to care. Also vice versa, again, there's a paragraph in the NCD political declaration on looking at integration of communicable and non-communicable diseases, specifically HIV/AIDS and TB.
Great. Thanks, Priya. We've also had a question from Danielle about the side event calendar, which I can just answer. So is there a version that has links or emails to RSVP? The answer is that at the moment the calendar that we've shared does have some RSVP information that you can click on, whether it be an email address or a link. As we get more information about the side events nearer the time, we'll obviously be keeping this up to date with as much RSVP information as possible. So this is a live document that we constantly update, and we're still hearing about new side events being developed. So it's still a bit of a moving feast that week, I would say. But I think it's great to see that we've got, I just did a quick count, and we've got 20 NCD side events during the week of the UNGA, which is impressive. And what our side events calendar at the moment doesn't do is it doesn't include the huge number of other global health events that will be taking place that week. For example, all of the TB side events that will be taking place, and we're expecting a lot more events on women and children's health, as obviously that community is often out in force that week too. So we can expect the calendar to be probably doubling by the time we actually get to the high-level meeting itself. We are getting a couple more questions in just now, so hold on, Priya, we're not letting you off the hook yet. Rosie from UICC is asking, do we have the timeline for when the co-facilitators want to finish the political declaration draft? Priya.
Yeah, hi Rosie. Yes, that is the question. I just touched base with WHO New York and some member state colleagues this morning. None of them have heard an update from the co-facilitators. The other spanner in this process is that, as many of you who are based in the EU know, the EU is on holiday by and large. So that is changing things a little bit. We originally understood that this process would be wrapped up by the end of this week, but given that as of this morning, member states themselves in New York have not heard an update, we're not entirely sure. Again, to flag, the only outstanding language as of now is on TRIPS, so it's unlikely that anything has changed. And I noticed a question from Helen about sort of the second draft dated July 26 posted online, the latest version. I think some people have been posting versions that they've received, and that was the version that was discussed on Friday. There have been small changes, but that gives you a good idea of what is in the document.
Excellent. Excellent. Thanks, Priya. Final question from Michelle, which I can just answer, is yes, if we haven't already, we'll make sure that the events calendar for UNGA is on our website for everybody to access. Okay, lots of questions there because there's a lot of information, and it's all happening obviously right now in New York. So we'll obviously keep you up to date after this webinar in the next week or so of how the political declaration negotiations go, and then keep you up to date on that one. Thanks very much, Priya. Let's move on to the next agenda item, which is a recap of the high-level political forum on the Sustainable Development Goals. Over to you, Jess.
Hi everybody, good morning, good afternoon and good evening. As Katie mentioned in her introductory remarks, this is the annual review of progress on the Sustainable Development Goals. For those of you that aren't already familiar with it, it has got an unhelpfully similar name to the high-level meeting, but it is indeed very different. SDG 3 was not actually reviewed this year, it was reviewed last year. Not all SDGs are reviewed every year. In fact, the only SDG that this happens for is SDG 17, and the others are on a rolling basis. So back in 2017, the theme was on eradicating poverty and promoting prosperity in a changing world, and SDG 3 was reviewed along with SDG 1 on poverty, SDG 2 on hunger, SDG 5 on gender, 9 on industrial innovation and infrastructure, and 14 on life below water. This year in 2018, it was very much focused towards the environmental related SDGs, so water and sanitation. SDG 6 was discussed, SDG 7 on sustainable energy, SDG 11 on safe, resilient and sustainable cities, SDG 12 on sustainable consumption and production, 15 on ecosystems, forests and biodiversity, and as always SDG 17. And next year in 2019, climate change will be reviewed, so different to the other, apart from the other environment SDGs that are reviewed this year, and also SDG 4 on education, 8 on decent work, 10 on reduced inequalities, and 16 on peace, justice and strong institutions, and again SDG 17. So the way that NCD Alliance is viewing the high-level political forum is an opportunity to show how health is linked to other sustainable development areas. So this year very much focused on links between human and planetary health, and great to see this coming this year of all years, given the focus on air pollution and climate change and other environmental risk factors for health within the NCD political declaration in the latest text. Sorry, that's the slide that we're supposed to be showing. In terms of some of the key messages and key facts and statistics that we were pushing around the 2018 UN High-Level Political Forum, it's very much about health being both an indicator of and a prerequisite for sustainable social and economic development, and showing how NCDs are linked with the environmental SDGs under review. Really framing the fact that industrial development and urbanization do present major challenges for both planet and people, but that we have an opportunity to shape these processes in order to protect and promote human and planetary health. And trying to pick out the many interventions to address health that offer clear environmental co-benefits, and drawing on the fact that strategic decisions made in sectors that span education, transport, energy, agriculture and food, urban planning, labour and even waste management impact on health and can accrue health benefits and savings. So the statistics that show the links between human and planetary health are growing ever stronger. 23% of all deaths could be prevented through healthier environments, and 1/6 of all NCDs, the highest links being with chronic obstructive pulmonary disease, COPD, and 43% of those deaths are actually caused by air pollution. So it's really an area that the NCD community can't afford to be skirting around anymore. But also important to note that the upstream drivers, challenges and solutions for sustainable environments and health share many commonalities, including the need to implement fiscal policies and combat commercial industries. So in terms of fiscal policies, back in 2014, Health and Environment Alliance have calculated that G20 governments paid out $444 billion in subsidies to fossil fuel companies, but the use of fossil fuels actually resulted in health costs that were 6 times higher than that. And the NCD community has a huge amount of expertise in fiscal policies for tobacco and alcohol, and increasingly also sugar-sweetened beverages that can be extrapolated to address the risks of fossil fuels and other environmental risk factors. And a few other key facts and statistics on that slide, which I won't run through here, but if you're interested, I would recommend reading the NCD Alliance advocacy brief that we pulled together for the high-level political forum that's available at that link on the bottom of the slide. In terms of how health and NCDs featured at the high-level political forum, member states that wanted to present their progress on the SDGs under review, and often also additional SDGs, could share voluntary national reviews. 47 countries were due to do this, and 45 member states did actually go ahead and submit one. There was lots of mention of health and NCDs, and indeed of environmental areas that are relevant to health, but only about 10 of those member states actually made direct links between human and planetary health, and talking about how they are as closely related as is the case. Interestingly, the plenary discussions, which can sometimes be slightly dry and require more reading between the lines perhaps than side events, the plenary discussions were actually much more progressive than the side events. A number of the side events throughout the week had either a limited focus on health and were focused on the environmental goals under review, or those that were focused on health didn't quite manage to integrate it into the wider environmental picture that applied for the rest of the week. So some silos definitely to be broken down still. Member states did adopt a ministerial declaration, which was very, very encouraging. Lots of mention to health and environmental risk factors throughout, including water quality, indoor air pollution, outdoor air pollution, risks of solid waste for health, and sustainable and nutritious food systems, and the sound management of chemicals, as well as biodiversity and health, which was discussed at the World Health Assembly just passed in May. And at this point, I'll move straight on to the regional committee meetings, but if anyone's got questions on either the high-level political forum or the WHO regional committee meetings, I can take them in a moment. So the dates for the WHO regional committee meetings are on this slide. We now know almost all of the topics that are set to be discussed. The exception for that is Euro, where there's just a selection of agenda items available on the website. But you can see that there's a fair spread. If NCDs aren't specifically on the agenda, then there are certainly other items that are relevant. Often UHC is discussed if NCDs aren't. The first WHO Regional Committee meeting is the Afro Regional Committee meeting, taking place at the very end of August. And there is a dedicated paper on NCDs for the Afro Regional Committee meeting, which is especially encouraging because it focuses on the 4 time-bound commitments on NCDs. In 2017, there was a paper on NCDs, but it looked at NCDs specifically within primary healthcare, so it wasn't especially easy to go into more of the upstream drivers on NCDs in terms of the commercial determinants of health or policies around tobacco or alcohol control, for example. And the year before that, in 2016, there was a paper on integrating oral health into the wider NCD response. But 2017 and now this year are the first time that we've seen a real focus across the NCD agenda more broadly, which is really fantastic to see. So there's a few key statistics from that paper listed on that slide that cite importantly that the burden of NCDs is going up in Afro, and it will continue to go up, and that there's a real need to reorient health systems to be addressing NCDs as well as to be reorienting policies. There are also some statistics from the 2017 WHO Progress Monitor there, and you can see how the number of member states is increasing, albeit not fast enough in terms of the policies that have been implemented in 2017 versus 2015. There is quite wide variation in spending on NCDs across across the WHO Afro region, which is sub-Saharan Africa. It'd be interesting to know what that spread is. I suspect the 38% of total health expenditure might be in countries like South Africa. It'd be good to see that breakdown. And a number in the countries that do have available data, over a quarter of adults, and it's interesting to see that women, as well as older people more generally, are found to have at least 3 of 5 major risk factors that the paper looks into, including smoking, fruit and vegetable consumption, physical inactivity, overweight, and raised blood pressure. The barriers that are cited in the paper, reflecting the UN Secretary General's report and the WHA paper on NCDs, are quite progressive in that they look at interference of tobacco, alcohol, and food industries, for example, alongside barriers that have been spoken about for a longer period, like lack of national capacity, weak health information systems, insufficient multi-sectoral approach to the NCD response, and inadequate funding. And there are some key actions in there, 7 for member states and 4 for WHO, but the link to the paper is at the top of the slide for anyone who would like to know a little bit more. If you are attending a WHO regional committee meeting, or you've got an invitation to attend and aren't sure yet if you'd be attending, we'd really love to know so that we can try and help coordinate advocacy across different groups. And just to mention as well that we know that PIH will be hosting a side event at the Afro Regional Committee meeting. So if anyone attending that in particular would be interested in attending, I'm sure PIH would be keen to pass on more information. And that's it from me.
Great. Thanks a lot, Jess. We haven't got any questions at the moment. I've got 2 up my sleeve. One is, so you mentioned with the regional committee meetings that we can see that AFRO and WIPRO have got NCDs explicitly on their agenda. For the others, does that mean that the high-level meeting on NCDs won't be discussed at all, do you think?
I would suspect that that is the case. I imagine that maybe 1 or 2 member states will be making statements on the high-level meeting as part of the discussion items on UHC, but certainly no in-depth discussion. And there might be side events or small roundtables on the HLM, but yeah, nothing major on the main agendas.
Mm-hmm. Okay. Thanks. And no doubt people in the network can be doing advocacy towards their member states within regions to be pushing reference to NCDs in their statements, as Jess said, because I think regional committee meetings are a good platform for the regions to be discussing kind of the next steps after the high-level meeting in terms of taking the commitments forward at the regional level. The second question I had was more related to the high-level political forum. So you mentioned that obviously each year at the high-level political forum, governments are reviewing a subset of goals. This is the second high-level political forum that we've seen. The first one focused on health. This one didn't. What do you think the lessons learned are for the NCD community of how much we should engage at high-level political forums that aren't focused on the health goals?
I think it was extremely interesting to go along and see how health featured and work out a little bit about which member states are making the links between health and environmental goals. I think if people do have an interest in engaging, it's going to be really important to start early, because the voluntary national reviews are normally written, should be written well in advance of the meeting, and it will be well worth engaging with other members of civil society that work in the areas that you're interested in linking NCDs and health to. So I think if you are interested in engaging in the 2019 high-level political forum, where the SDGs under review are those on education, work, inequalities, climate change and peace, well worth doing a little bit of early thinking. Great.
Thanks very much. We haven't had any questions come in, so I suggest let's keep moving to keep on time. So thanks very much, Jess, for that presentation. Let's move now to Lucy to hear an update on the Enough campaign.
Thank you very much, Katie, and hello, everybody. It's great to be with you today, and thank you for staying on if it's late where you are, and thank you for joining if it's early. So going back into the Enough campaign, which is going great guns. So we've recently published, and I think we've spoken about this briefly previously, but we've published 2 brand new resources to support advocates on social media and in amplifying the Enough campaign. The first one is Social Media Basics. It's great for individuals, and it's also good for organisations to explore new parts of social media, to explore social media that they may be on but trying to strengthen their presence on. So it's quite a lengthy document and more generic, so it is less time restricted. It's not focused only on the high-level meeting, but provides advice and guidance on using social media from Facebook and Instagram to all sorts of other platforms like WhatsApp to make your campaigning a little bit more effective. And Campaign Fuel is more focused on the high-level meeting itself and the Enough campaign. It has some suggested messages, handles of key people and organisations that you might wish to link into, resources that may help with development of advocacy messaging and sharing them, and some other bits and pieces. So we suggest that you explore those too. That one's a little bit shorter and more for doing very specific advocacy on certain platforms. So the Enough NCDs hashtag has been really active on social media lately. Obviously with the interactive hearing, that was a bit of a peak, and we had quite a lot of reach in dozens of countries, over 100 cities, and to millions of people. So that was brilliant, and we again thank everybody who's been involved in amplifying Enough. We've had some terrific additions to the campaign as well. We've got a great Vox Pop video from Richard Horton, Editor-in-Chief of The Lancet, who's had enough of the NCD community being polite. That's a good one to watch if you haven't seen it already. But there's lots of other additions to the campaign website as well. So we've also got new voices of change, and we encourage you to, again, add your own voice of change, add what you've had enough of, what you'd like to see more of, and we'd like to compile these voices and messages to make sure that member states are actually seeing that people around the world actually have a say in this. It's not only what advocates who are perhaps a little bit more refined in their messaging. Everybody has a say in this. We've also got new champions, and so we've got some terrific ones from South Pacific, from Jamaica. We've got the Minister of Health. We've got Anders Nordstrom, who's the global ambassador, the ambassador for global health from Sweden. Flavia Bustreo, Corinna Hawkes, Segun Odegbami from Nigeria, who was the captain of the Nigerian football team, has joined in as well. So we've got a fantastic selection, and we'd really encourage you to nominate champions that you're aware of that may be within your network, so we can keep raising awareness through new voices around NCDs and specific issues and concerns that people have, or simply celebrating great things that some countries and people and organisations are doing, so please do share. The map of impact is still being used, and that's going to be particularly useful for the Week for Action on NCDs, where people can log in the details of events and activities that are taking place, and it will be much easier to then find what's happening in the area that you are in. Another great resource that we have worked with the Great Healthy Caribbean Coalition on is these Call to Leaders social media cards, which we have created a template for that anybody from any countries can actually use. So they're being used quite extensively in the Caribbean region on social media, and they're quite effective in engaging particular heads of state and government and saying, are you going to join us at the high-level meeting, and what is your engagement going to be? So we've got some templates for both Twitter and Facebook and Instagram, and if you'd like to use those, please contact us, and I will share the access links to those if you haven't got it already. I've already mentioned, and we've mentioned a few times, the Global Week for Action on NCDs, which is taking place from the 3rd till the 9th of September. We appreciate there's a public holiday in there for some parts of the world, but the great thing about it being a week is that a public holiday is just one day out of 7. So we're hoping that there's going to be a lot of activity around the world, whether it be calling for accelerated action on NCDs and continuing that theme of enough and indignation and frustration, calling out the weaknesses in the political declaration, or celebrating leadership and progress, or really calling for that movement from commitment to action and saying, this is the next day after the high-level meeting is the day when action absolutely needs to start. So it's far enough in advance of the high-level meeting for people to still be in country and still have an impact on what leaders are saying and at the high-level meeting itself, and also hearing what their commitments are going to be to translate into the next phase beyond the high-level meeting. Again, we've got some templates, some basic social media graphics at the moment for promoting activities and events that you may have planned, and we have got some in the pipeline, some comms and event planning guides for helping to finalise any details that you need to finalise, and some media templates which will be available hopefully this week for you to be able to start adapting and using as needed. As a few people have asked us recently about what the plans are for on-the-ground activities in New York. So we're still waiting for confirmation from WHO about whether there will be a specific Health for All themed event around the 22nd or the 23rd of September. We anticipate that whatever will be held would be across NCDs and TB and other UHC-related topics. So it will have a very broad theme around Health for All. We understand that there are other colleagues in New York that are also planning some street action. So we will keep you posted about these events as details come to light on enoughnCDs.com and also our social media. And that's all for now.
Fantastic. Thanks, Lucy. Lots of stuff going on the Enough campaign. We haven't received any questions at this point. So I think everything must be crystal clear. Thanks, Lucy, for the presentation. So that leads us to the end of the webinar. We finished early for a change, which is welcome, no doubt. As you can see, a lot of stuff going on at the moment on the NCD side of things. Unlike the EU, summer months are not really a downtime for us at the NCD Alliance team or the NCD community as a whole. A lot of things going on. Just as a kind of wrap up of some of the kind of action points that we talked about today on the webinar. Firstly, 7 weeks to go until the high-level meeting, so this is a great opportunity for advocates around the world to be still pushing their heads of government and heads of state to attend, so that we can increase that number of 14 heads of government and heads of state to more like 35 or 40 or 50 even, because it's really at this point that governments are deciding who from their delegation is actually going to be attending. So great opportunity to be sending those letters into your heads of government to encourage them to join. Secondly, as Priya mentioned, today is the deadline for registering for the high-level meeting. If you don't register today, you won't be able to get into the high-level meeting. So really encourage everybody who hasn't done it to be registering today. Thirdly, I mentioned our new membership structure and offering, so really encourage everyone to check out our new membership materials, and applications are now open to become a member, so really encourage organisations around the phone to be considering to become members of NCD Alliance. Fifthly, Jess mentioned the regional committee meetings that are starting as early as next month in Afro. Please do let us know if you're planning to attend, and we can link you into other NCD advocates attending, as well as sharing with you our advocacy briefing materials that we're producing for the RCMs. I've lost track of my numbers, but I think I'm on number 5. Lucy talked about the Enough campaign, an awful lot of stuff going on around the Enough campaign. Please do use the Enough hashtag. Encourage you to submit voices of change, as well as calling leaders, the templates that we've developed for the calling political leaders to attend the high-level meeting, as well as most importantly encourage you to get involved in the Week of Action on NCDs. It's a great opportunity for the whole community to be taking action at the national, regional and global level in the lead up to the high-level meeting. Finally, we are planning our next webinar on the 12th of September. So this next one will be just before the high-level meeting. Opportunity to be updating everybody on the political declaration, which we will surely have a final version of by then, as well as obviously all of the different events that will be happening during that busy week, as well as logistics and actually how to get into the UN and navigate New York during that very busy time. So look forward to speaking to everybody on the 12th of September, and enjoy the rest of the summer. Thank you. Goodbye.
And this concludes today's call. Thank you so much for your participation. You may now disconnect.